Okay, well, just real briefly, my name is Dee Wilson. I live in Tacoma. I've lived in Tacoma, Washington now since 1997, I guess. And I worked in child welfare, believe it or not, since about not for 50 years, since 1971. I worked for the child welfare system in this state for 26 years, from 1978 to 2004. I've worked at the University of Washington School of Social Work, taught in the MSW program. I worked in Casey Family Program for 6 years, retired in 2016 from there. And since then, I've been doing quite a bit of training in child welfare. I do training on neglect. I do training on critical thinking, which I'm going to talk about in a couple of days for the causes. And then I do training on preventing burnout and secondary trauma in child welfare. And in past years, I've done training on a lot of other subjects as well. So poverty and child welfare. And by the way, this Zoom thing is weird. It's very difficult to have some kind of interchange, and yet it's really only interesting if there is. So, you don't really have to wait. You can put questions in the chat box if you want to do that, and I'll try to respond to them periodically, or you can just interrupt. You can just stop me. I found that in past years, I've been to a lot of trainings, and, so I could tolerate about 20 minutes of someone talking at me about something. At that point, I usually want to ask a question. And I think a lot of other people are kind of like that. So, sometimes on Zoom, it's very tempting for trainers to talk too much rather than too little and not leave enough time for the interaction thing. So, you guys can do whatever it takes to interrupt and stop and pose questions. Now, this subject, poverty and child welfare, this has been of interest to me for as long as I've been in child welfare. And I began working in child welfare in Colorado in the early 1970s, so a long, long time ago. Well, so just a little bit of a historical perspective. So at that point in Colorado, the child welfare system there had probably been created within the last 10 years, maybe even less than that. And it had been mostly created over a concern with battered babies, if you remember this, those of you who are on the elderly side, as I am. So the concern was about severe physically abused little kids. And so, as amazing as it sounds, the child welfare system was created by 50 states passing laws with creating a child welfare system within about a period of 10 years. And then in 1975, the CAPTA passed, so the federal government passed various and sundry guidelines, but the feds were sort of following the states at that point in time. So there was a strong public interest and focus and concern with very severely abused babies. And so that's what I was trained about. And I was trained by people who were world-class experts on that subject. They had become literally world famous at that point. People like Henry Kemp and Pollock and other people like that. And so it was very much of a surprise to me then that when I began working as a CPS caseworker in Colorado at that point in time, I really didn't encounter battered babies, or very, very rarely. I maybe I'd get 100 to 120 assignments a year, and maybe one or two of those would be battered babies. And yet most of what I saw every day was, of course, neglect cases, low-income families, and this was just so odd. There was no training around neglect whatsoever. I mean, it wasn't even mentioned at that time. And so I could hardly understand it. I mean, so all the training was about something that I saw very little of as a CPS caseworker. There was no training about what I saw every day. And not only no training, there was no interest. And so in the time that I was in Colorado there for 7 years that I worked there was one pediatrician in the Denver area whose name was Henrika Cantwell, and she was the only person that I ran into during that period of time who was even interested in neglect, or even had a vague interest in it. And she really had a lot of interest. She had a lot of interest in early child development. So that situation didn't really change for really a long time. Well, why didn't it? Because, of course, the child welfare system had been created both in states and at the federal level over a concern with severe physical abuse. And it was created through the myth of classlessness. And so at that time, it was very commonplace to say that abuse and neglect happens in all social classes, which of course it does. That's kind of a truism. That would be as interesting and as valuable as saying that the sky is blue. But of course, it's true. And then, but there was a lot of resistance to the thought that um, poverty had any kind of role to play at all. And so, and for many years, that was very actively denied by both policymakers and by many, but not all scholars, and by most child advocates who were responding to messages that they heard from scholars for the most part, right? So that situation, as amazing as it sounds, lasted for about 15 to 20 years. It took 15 to 20 years to come to a realization among most scholars and some child advocates, which has increased over the years, that poverty was not only a factor in child maltreatment, it was the most powerful factor. And so, and there was tons of information at the time. So it could not have been that the information was unknown or the studies weren't out there or the research was vague on the subject or something like that. No, there was a very determined denial in place. And so, and that denial had kind of a political foundation there, right? So where the situation started to change was that in the 1980s, the federal government began to fund they funded the first of 4 national incident studies. And so prior to that, most child abuse and neglect studies have been of CPS reports. And so it was commonly said, for example, that the reason low-income families show up a lot more than it seems like they should in CPS reports was because they were reported. I mean, so there was a bias in reporting. And the middle-class families just weren't getting reported, and that was the reason that low-income families were in the CPS system. Well, the NIS studies were not based on CPS reports. They were based on professionals' knowledge of child maltreatment independent of CPS reports. And the main lesson from them, there have been 4 of those studies over 20 years, and the main lesson from those studies is that the very strongest association between child maltreatment and any other factor is with poverty. And so that kind of confirmed what other studies had said over a period of decades, but for many scholars, those were the decisive studies. That stopped the scholarly debate, but it didn't stop the child advocates. So here's a sort of a lesson in child welfare. Once scholars have gone around saying mistaken things or erroneous things, and child advocates have heard those things in meetings, they strongly believe they're true, and they're very, very reluctant to give up those ideas. So it took a very long time after the scholars quietly abandoned the sort of the myth of classlessness idea. It took a long time for other people in the field, including people I worked with in child welfare, just to acknowledge the obvious, that we were dealing with poor people all the time, every day. And that it was really pretty rare to have a middle class family. It wasn't unknown. It happened from time to time, particularly in sexual abuse, but not in the most common type of case, which is neglect. So here's the second main point. The strongest association between poverty and child maltreatment is between poverty and neglect. So the national incident studies, for example, the first study found that there was something like a 9-to-1 difference in the incidence or the prevalence of neglect between families that had incomes under $15,000 a year and over $15,000 a year, a 9-to-1 difference. There was about a 5-to-1 difference for all types of maltreatment and for physical abuse. So there's still an association between poverty and physical abuse, and at least in CPS reports, there is a relationship between poverty and sexual abuse, just not as strong. The strongest relationship is with neglect. Well, why is that important? Because 75 to 80% of children who were victimized, found to be victims in the US child welfare system are neglected children. So compared to about 20% of the children who have been physically abused, and compared to less than 1 in 10 of the children who've been sexually abused. And so you may say, well, those numbers add up to more than 100%, because of course, which is right, because some children are of course abused and neglected in more than one way. They're both neglected and abused, which is something that I've been writing about recently, and we'll talk about more as we go here. So again, a very long time for neglect to get on the radar screen, a very long time for there to be a sort of a general acknowledgement, beginning with scholars, that there was a strong association between poverty and maltreatment. And a very long time for there to be scholarly studies on neglect that were as common or as frequent as studies of physical abuse or sexual abuse. So just one other thing I want to say, and then we'll stop and let people ask questions or anything. The U.S. child welfare system is very idiosyncratic. It's you know, if you compare the way we do child welfare in this country and the way that child welfare is done in, for example, in Western Europe, in most of Western Europe, and in other English-speaking countries around the world, as in Australia, New Zealand, so forth. Our system is very, very different. And the way that it is mostly different is that it has such a greater percentage of both investigations, victims, kids in out-of-home care, so forth, are the result of neglect. We have a very overwhelmingly a neglect-oriented kind of system, again, arguably because of our child poverty rates in the US, which are anywhere from 3 to 4 times the rates in some parts of Western Europe. More recently, in recent years, Australia's child poverty rate has come up, and yet they still probably have about half the neglect cases that we have as a percentage of total CPS reports. So I used to say, years ago when I did this presentation, I used to say that the child welfare system in this country was almost totally shaped by poverty, which, you know, a little bit of an overstatement, as will, you know, probably most of you would understand immediately. But I kind of used to say that to make a point. However, in recent years, as some other countries' child poverty rates have begun to, you know, at least approximate our child poverty rate in the US, they still don't have anywhere near as many neglect cases as we have in the US. So it's not just poverty isn't the total explanation of that, as I used to sort of insist it was. So I think with that, before I go any further, I'm going to stop and I'm going to see if anyone has comments or questions before I go on here. Any comments about the association between poverty and child maltreatment, the reason for asserting that that's so, the contrast with systems in Western Europe, the association between poverty and neglect, any comments or questions about any of that?
Yeah, and okay, so many times from the cases I've had over the years, it seems like poverty is one of the big things. It was all about money, whether the kids have been pulled out of the home and they weren't getting funds from that or getting funds from other things. It does seem like it was a really driving force for some of them. In other words, to be able to get their child back so that they could have money again, basically, to support themselves.
Yeah, and we're going to talk a little bit more about that as we go. So, and I'm going to come back to that because your point is good, particularly about the welfare aspect of it and losing the benefits when kids go into foster care and so forth. From Joy, do we use the same ratings as Europe? I don't know quite what ratings means. What do you mean by ratings, Joy?
Okay, so it broke up. I'm sorry. Can you repeat the question?
You say, do we use the same ratings as Europe? What does ratings mean? What do you mean by ratings?
I guess I must have just inadvertently come in there. I don't know about ratings. In other words, I think it was just that in other words, funds were coming in from different sources, and the kids were pulled out, and they weren't there anymore.
Okay, we're going to come back to this issue of the relationship between, for example, TANF and child welfare here as we go through this. So just a couple of other pieces of information that I want to mention just to give a sense. So far I've given you kind of a national picture. So about 10 years ago, Partners for Our Children, which is a research and training institute at the University of Washington, I helped to develop that when I was there. The scholars there at the time at POC did a study in Washington State of several hundred parents who had open child welfare cases at the time. And these included parents with kids in foster care, parents who had just been investigated, parents who were receiving services. Well, what this study found was that in this study, remember, pretty large sample of several hundred, half of these families at that time had incomes of $10,000 a year or less. Half. So that's just not poor, that's severely poor. 60% of the parents of children in foster care had incomes of $10,000 or less. So when you start thinking about the poverty issue, it's very useful to have three categories in mind here. There's being poor, and most people, most scholars, when they talk about that, they're talking about the federal poverty standards, which in and of themselves are highly questionable. But that's the usual sort of the way of defining poverty in the US, right? Then there are those families that are severely poor. And severely poor means having an annual income less than 50% of the federal poverty standard. So as an example, for a family of three today, that would probably be something like $24,000, $25,000 a year, maybe. Half of that would be less than $12,000 a year. So to be severely poor would be something like having an income less than $11,000, $12,000 a year. So some of you are from King County. So just imagine living in King County on an income with a child or two with an income of less than $11,000 a year. No one can do that. And then there are the desperately poor families. So several years ago, two scholars whose last names are Eden and Schaefer, and I have tell you a little bit about it. They published a book called Living on $2 a Day in America. And so that's $2 a day per person in the family plus food stamps. So that turned out to be 4% of the child population in the United States. So I want to say that again because this is so incredibly shocking. 4% of American children 5 years ago were growing up in families whose income was no more than $2 a day a person in the family. So if that was two children and a single parent in the family, that was less than $6 a day times 365. The family was living on about a couple of $1,000s a year plus food stamps. And that was 4% of the population. Okay, now, for reasons that I don't understand, Washington State's rates of open cases with families who are either severely poor or desperately poor are higher than in most of the rest of the country. So in some states, they have kind of rates of severe poverty for CPS cases that's, almost half of Washington State's. I mean, so the families are still really poor, but they're not as poor as many of the families in the state. So if you are a severely poor family in Washington State, it is a very good chance that you are on the verge of homelessness or you have had episodes of homelessness. You are one check away, one little problem away from being homeless. You are probably occasionally having to double up with relatives or friends. You may be food insecure. There was a very shocking study that came out during the pandemic about a year ago that found that almost 20% of American children during the pandemic were food insecure. And that wasn't just child welfare families. That was almost 1 in 5 children in the United States were not sure where their next meal was coming from. So that means they weren't eating 3 meals a day on a regular basis. Some days they did, other days they didn't. That's what it meant to be food insecure. So that's sort of the nature of the child welfare system here. So one of the things to kind of understand is that when we talk about poverty and child welfare, we're really talking about the gradations of poverty. That is, severe poverty, so much more poverty is impactful, but severe poverty, much more impactful on parenting. And when you have people who are desperately poor, living on less than $2 a day, that's just completely impossible. So one of the things, for example, the Eden and Schaefer book found out is that in some states in the South, it is very possible for kids to starve to death in the United States. And I'm not speaking in a metaphorical way. There were kids there in Mississippi who were documented in that book who were literally starving to death, and they were in public schools. So this is how extreme the situation is there, right? And so I've already mentioned here that the association, of course, mainly is with neglect. And the other characteristic of the US child welfare system that's very different than Western Europe is it's very focused on young children. 20% of kids who enter foster care is 0 to 1, 50% are 0 to 5. Compared to Western Europe, if you go to Scandinavia, they don't have a bunch of infants in foster care. They have a lot of kids in foster care. They have higher rates of foster care in Scandinavia than in the US. They don't have little kids. They don't have infants and babies. Why? Because they have better social support systems. Those are social democracies. So the other issue then with how a child welfare system function in a nation, it's not just a function of a poverty rate, as important as that is. It's also a function of the social supports available to low-income families. It's that combination. It's the combination of annual income plus the presence or the lack of social support that would either buffer or not buffer the effects of poverty there, right? Okay. So the second point, I guess, the most I want to make is that as important as poverty is, anyone who has, some of you are very, very experienced in CASA. I worked in child welfare for many, many years. And of course, the families that I encountered in child welfare, they were poor, pretty much almost 100% of them were. Not quite 100%, but almost. But they also had three other main problems. They were drug alcohol involved. They had chronic mental health conditions, particularly the mood disorders, depression, PTSD, and anxiety. And they had domestic violence. And sometimes they had so this is the big four, as I call them, the sort of the four horses of child welfare, the four horsemen of child welfare. That it's those four things. It's not just poverty. It's poverty in combination with drug alcohol abuse, with chronic mental health conditions, and with DV, and with many of the families, particularly the chronic families, it's all of the above. And not just sometimes all of the above, there are also families that have other factors, such as cognitive impairments, and many other issues as well. But the big four: poverty, drug, alcohol, mental health conditions, and DV. Okay. What scholars have not been able to do, and partly because they haven't tried hard, is to describe the causal relationships between these four factors. So here we're going to do a little bit of a brainstorm thing here. So, and again, I'm not looking for a right answer because scholars haven't given us the right answer. And it probably is true that there isn't a single right answer to this. But so I want you to think about, what do you think the relationship is between and among these four main factors that we find in serious cases of child maltreatment in this country? Poverty, substance abuse, chronic mental health conditions, and DV. So that's the question, and you can put an answer in the chat box. You can speak up. And again, this isn't a matter that I'm sitting here with the right answer, because I have opinions, obviously, which I will give you, but there isn't any scholarly consensus on this subject. So what causes what here? Is poverty the cause of all these things? Is it the other way around? Is it drug, alcohol first, mental health conditions, and then families are poor as a result of that? Is it, what do you think?
So I'm thinking drugs would be one of the big things, but I think it's all tied together. In other words, you can be in poverty, not on drugs, and still be doing, successful. Or if you are in poverty on drugs, things just start going wrong.
Yeah, so it could be, and usually with lots of the families, it's, of course, it's both things. And of course, if you have chronic mental health conditions and or you're drug addicted, it's going to be very hard to find a job. And if you find a job, very hard to hold a job. And so, and then the question of, well, what comes first? You would have to really know something more about the childhood of the folks involved. And I'll tell you something more about that in a minute here. So any other ideas? What do you think? The causal relationships between and among poverty, drug, alcohol, mental health conditions, and domestic violence. Sometimes, Mary says, sometimes one feeds into the other. Yes, that's true. A drug addict becomes poor because of addiction, or poverty leads to addiction. That's true. Both things are true. Carrie says, I think mental health can lead to each of these. That's also true. So the question is, when we try to get at the causal nexus, is, well, what came first? And obviously it could be all of the above in specific cases, but Ryan, the idea that this is as good as it gets for me, I'm not sure quite what you mean by that, Ryan. You want to say anything more about that?
Sure, like just the mental aspect, and there's no hope for me beyond this. This is just where I am. This is who I am, and this is as good as it gets. Mm-hmm. And there's no desire to overcome that, or maybe there's not even a way for folks to see beyond, the trailer park or where they are, their lot in life.
Yeah, so I describe this perspective as hopeless, helpless. And so this is sort of at the end of a lot of years in development, a lot of the time, and particularly for parents who've grown up in poverty, and many of the families that we deal with, that's true. They're in about, depending on which study you look at, particularly studies of the intergenerational transmission of neglect. I did a long paper on that within the last 3 or 4 years. About 40 to 50% of those families grew up in poverty. So the intergenerational rate of transmission for those chronically neglecting families was in the 40 to 50% realm. And many of those families grew up poor. And of course, those parents grew up poor. And of course, they were maltreated as well. So there's a group of people who did, in fact, grow up in poverty, and they were maltreated in childhood. And then they developed early onset mental health conditions, a lot of times in early childhood or in adolescence. And then they began to use substances as a way to control their reactions to mental health conditions. So that's a very common, I'm not saying that that's the only causal nexus, but it's a very common one. And there are some studies of domestic violence and of people with co-occurring disorders that have confirmed this nexus. I mean, particularly if you look at women in publicly supported substance abuse treatment programs or mental health programs, women in prisons as a result of drug, alcohol kind of issues there, right? A lot of times you find that kind of nexus. You find early poverty combined with histories of trauma, followed by early onset mental health conditions, and then drug, alcohol at some point. And then, of course, you end up with intimate violence in late adolescence or in people's early 20s to mid 20s and so forth, right? And then the cycle, and that is about, in studies of chronically neglected families, that's about probably an intergenerational transmission rate of neglect of about 40 to 50%, something like that. Still, there are plenty of people who escape that. So it's not like a fate, but nevertheless, it's true, right? Carolyn says, I'm thinking poverty comes first as a cause, and of course, and lots of times it does, then perhaps alcohol and drug issues. Single parent families, yes, I'm going to say more about that in just a minute here. So perhaps there's not as much as in other families. Mental health issues may not be as visible as poverty and drug, alcohol. That's true, and I think that's been a big failing in child welfare. That is, it's been more apparent and more common to focus on substance abuse than it has on the mood disorders, and especially depression. And I'm going to say a little bit more here about the causal role of depression here in just a minute here. And then Carolyn says, all interact, of course, and I think they get attention of CPS. Probably 2 or more causes occur at the same time. Yes, and in a lot of the families, it's all of the above. And particularly the more chronic the family is in terms of reports, and in terms of coming to the attention of CPS, sometimes kids have been in foster care, they've been returned to parents, they come back into care. So there's reentry into care, particularly for those chronically referring families. They frequently have all the above and then some, including histories of incarceration. Sometimes maybe 15% of the families have IQs under 80. So yeah, so you get a whole complex of factors here. And I think it's only when you get looking at the sort of the longitudinal kind of studies that you start to get a picture here. And probably the scholar who's done the best work on this in the last 10 to 15, 20 years is a woman named Kathy Whittam, who began, if you can believe this, doing a longitudinal study probably in Kansas in the 1960s, and followed those families, those parents who were found dependent in that child welfare system in the 1960s for over 40 years. So, and then in her 60s and 70s began to publish studies of that. And so she found a lot of intergenerational transmission in those families, and a lot of it was focused on depression here, which I'm going to talk about in a minute, as sort of the mediator, sort of the causal factor that seemed to be very, very important there. The point that Whittam makes is that poverty is so much more impactful when it is combined with these other factors. It is it's the sort of the social and economic issues combined with the psychological afflictions. That is what makes child welfare so very, very difficult to treat or to help a lot of the families that we're dealing with. It's that particular combination. It's not just the substance abuse and mental health co-occurring disorders. A lot of the families have those. it's those psychological afflictions combined with the economic causes. It's that. And that is what makes it a lot hard to achieve change, I think, in lots of families' lives there. Now, one thing I do want to mention is that when we talk about sort of the influence of poverty on families, we're not just talking about, or should not be talking just about their annual income. I mean, so far, that's what I stressed, the difference between families being poor, severely poor, and desperately poor. That's sort of a straightforward function of income. But there are other kind of indicators of social economic disadvantage which make the impact of annual income just so much greater. And so let me just give you a few examples of that. Someone mentioned earlier single parenting. So you combine someone who's very, very poor, already severely poor, and they are a single parent. They don't have any other kind of support to help them with parenting. Many times they've already alienated their extended family because of drug alcohol issues or because of other issues as well. So single parenting would be another example indicator of social economic disadvantage. Residential instability or homelessness. That obviously that's almost a proxy for being severely poor, but it's another thing on top of the annual income kind of issue there. And in past years, being on welfare compared to working, families who were on welfare had tremendously higher rates of report to CPS than the families who were working. So for families who had at least three of those social economic factors, social economic sort of disadvantage factors, in addition to low income, much higher rates of CPS reports for those families. So it isn't just solely a matter of poverty, or it's not just a matter of annual income, even when you talk about kind of the poverty kind of issues here. Right. So Tim says, identifying early childhood challenges and providing unbiased intervention and support for the kids and parents is where the money should be spent. Yes, and so we are now, I strongly agree with Tim on this point. So we are now in a very, very unusual, to say the least, period in this country where families with kids are receiving $300 a child in a sort of a child supplement, kind of an income support kind of function. And that's for all income groups. Well, this is based on the kind of support for parenting that's very, very common in Western Europe. And so, I mean, in theory then, if we believe that somehow all of that assistance has reached all of the parents in this country, there should not be anyone who's desperately poor. That probably is not true, but actually you can just see the potential effect of this benefit of $600 a month. That this single benefit, which is as things stand now, will run out in a year. That benefit has the potential to cut child poverty rates by 40 to 50% in this country. There would be nothing that would have more effect on the prevention of child maltreatment, especially neglect, than that. That would be, you can talk about every evidence-based prevention program in the universe. None of them in combination have the potential to have the effect of giving families $600 a month, particularly the low income families. So the question is whether that benefit sticks here in terms of social policy. And currently it doesn't look great from the standpoint of the US. But again, we, for the first time ever, what a big surprise, actually have done the right thing here by low income families. And so now the hope is that it's going to be sustained in some way. There had been in recent years, probably, I don't know, at least half a dozen experimental studies with giving low income families just a monthly benefit of this type. And then comparing rates of CPS reports and other kinds of issues there with child development with the experimental group versus the control group. So it turns out that just giving families just a few $100s a month, you don't have to give them a huge amount of money. It's really possible to have an aggregate impact on CPS report rates by just making families less poor. Not curing poverty, just making them less poor. So that is a especially really powerful kind of an intervention at the prevention, early intervention sort of point. Now, the thing, however, I have to say is that works for prevention, early intervention. That doesn't work once families have substance abuse, mental health conditions, and domestic violence, as well as all of these other things as well. So if you're going to have really interventions, they have to be early. For impact on CPS report rates and on foster care rates. Those services have got to be given early in the case, right? So, so let me stop here and see if anyone else has comments or questions before we go on here and talk about some other things here.
Dee, what are the best practices, Western Europe? And when I went to Australia and New Zealand, I noticed a whole different culture and people. It was just different. I mean, they get the shirt off their back for you, and there's incredibly grounded conversations that I was able to have. But could you touch on maybe a couple best practices that we as advocates could keep in mind for children and families? Thank you.
Sure. So let me bring up what I think is maybe the single most important one for the families who have the CPS reports. So the first thing is the earlier that the intervention happens, the better. So just to start off, and I mean, ideally, intervention would start during pregnancy. But at the latest, with some of the families, particularly the ones that had a lack of prenatal care or who had kind of drug alcohol exposure of the fetus and so forth, there ought to be a case open on the day the child's born there, right? The single most important thing that can happen with lots of those kids is that you reduce the family's child care burden. So remember, we're dealing with lots of parents here who are single parents. And so some of those single parents have extended families who help them, but a lot of them don't. Some of them have alienated all of their extended families. So if we wanted to do the one thing that would probably have the most tremendous impact, apart from just increasing their income, it would be to help them reduce their child care burden. Well, how would we do that? You would start off with some kind of crisis nurseries. You would start off with a sort of a day nursery type of program, even for the very youngest infants. And then once kids got to be toilet trained, you would put them in the child haven type of programs, into therapeutic child development type of programs. There ought to be a focus from day one on the development of those kids, not just on whether they're being killed or not, or severely abused or neglected in some sort of obvious and apparent way, but on their development. And so the first way to help the parents then is to reduce their child care burden. And the second way would be to increase the emotional support for those parents initially. So one of the most promising ideas in child welfare today is to begin to use foster care to some extent or other as a support for birth families rather than as an alternative to birth families. So there are still going to be kids that need to be in foster care, in fact, have to be in foster care to protect their lives. But there's also a group of other kids that can probably remain in the home if the parents have respite care on demand, if they have very good family support services on demand, and people there who are emotionally supportive with concrete supports from the very first day the child is alive, after the child is born. So that's kind of for starters. The second thing, for those of you who have very young children on your, as a cost and so forth, one of the things you really want to focus on very, very early is the physical health of kids. So now in the last few months, I have summarized a whole bunch of studies on the physical health of maltreated children, both maltreated kids who remain in the home and maltreated kids in foster care. And so when we talk about the concern with child well-being, we're just not talking about the mental health conditions of kids, as important as that is. We're talking about their physical health conditions. So kids who live in families with CPS reports. And so I just want you to just reflect on this here for just a minute. Those kids are anywhere from 2 to 6 times more likely to die in childhood than kids who do not have CPS reports, without doing any analysis of risk factors, without breaking the child welfare population into categories: high risk, moderate risk, low risk. Just take anyone who has a CPS report, screened in or screened out, and control for poverty, and control for single parenting, control for paternity status, and you still have very, very large differences in all-cause mortality for that population, not just in child maltreatment deaths, but in all-cause mortality, that is death from physical disease, death from SIDS, death from accidents, death from, as well as from non-intentional injuries as well there. So yeah, so some of the things are, these are very, very obvious things. So I guess I want to say one more thing in terms of social policy here. If we really wanted a child welfare system that worked better than the one we currently have, there would be a public policy goal that a CPS report would never be the first and only intervention a family receives. The fact that we have this single standalone child protection system for all of these families, and we're waiting until kids are really literally in physical danger of death before we intervene, that is crazy. That is not how a thoughtful child welfare system operates, and yet it's what we have in this country. So we don't have to stick with that. I mean, we really need to think about supporting families earlier before any kind of serious maltreatment happens. And we need to think about the physical health of infants and toddlers. And we need to reduce the child care burden particularly on single parents, as quickly and as fully as we are able. And then once for the foster care group, now the cost is you have kids in foster care, right? If you want kids to be reunified safely, then part of our reunification plans need to be a housing plan. So when you talk about poverty-related services, there had been reunifications, one of the best studied subjects in child welfare in this country, several hundred studies of reunification over 30 to 40 years. And so what a number of those studies have found over and over again is that the single most valuable service that we could probably give a lot of families is not necessarily substance abuse treatment, though they need that. It's housing, and not transitional housing, permanent housing that they can actually afford. And so that is a way that we can improve the child welfare systems today. And we have a chance now to do that with the Family First money. Whether that will really happen in this state remains to be seen here. So let me stop here. And before I go any further, I want to talk a little bit about depression here. And I want to talk a little bit about the powerlessness aspects of things. But before I do, let me see, it's 10 minutes till 7 here. So we still have about 30 to 40 minutes here. So let me stop and see if you have questions or comments here.
Dee, I'm sorry, Dee, this is Tim again. What would you recommend volunteers and advocates of children? Could you help us on 1 or 2 points regarding communication with the foster care provider and their relationship and potential relationship and the potential ability, if it's safe, to coach and be a part of the reunification? Could you comment on that, or is that too general?
Yeah, no, I understand the question. And so let me just say that there have always been some foster parents in this state who have operated like that. So this is not exactly a new idea. This is an old idea, which is now someone wants to make, or a lot of people now have become interested in making a matter of policy, right? But there have always been a group of foster parents who kind of little by little learned on their own that they could form safe relationships with birth parents and that they could help the children by doing that. And some of them over time, little by little, not all at once, little by little, they became supporters, advocates, coaches to the birth parents. And some have even maintained relationships with birth parents after the kids have gone home. And they have continued to become almost extended family members here. So the people who are going to sell this idea best to foster parents or other foster parents, it's not some person outside like me or someone else trying to talk someone into something here, because initially lots of foster parents have reservations, which are very understandable and sometimes completely rational about their safety. So this is something that they have to gradually be able to get into. I think they should be encouraged whenever possible to meet with the birth parents initially in a safe, maybe in the office, somewhere else, They don't need to take any large risk initially. They need to get to know one another to form a relationship. So this is not an idea where an agency should start to mandate things like, you got to do this, you got to do that, you got to do the other thing. And that's not really the way to work with volunteers. The foster parents are volunteers. So you have to show them, it's very good to show them models, people who've actually done it, not speculated about doing it, done it, and done it successfully over a period of years, and have really helped the kids as a way of doing it. So you have to show kind of the possibility of it. Now, the other thing that would be very, very helpful, and I did this when I was a regional administrator. I was a regional administrator for 7 years in Region 6. So that's Southwest Washington. We had a project at that time in Vancouver where we paid foster parents anywhere from $300 to $400 a month to coach a birth parent, not the birth parent of the child in their home, but some other birth parent. That was a very successful model. So we are underestimating the uses to which foster parents can be put here. I mean, many of the people are very experienced. I mean, many of them identify as professional foster parents. And by the way, just to say this editorial comment right off the bat, we're never going to solve the foster parent crisis, the foster home crisis in this state without professional foster parents. It cannot be done. There is no other solution. And the fact that lawmakers, legislators will not even consider that, that's just a disgrace. But the idea that we can put foster care to all kind of different uses. Some foster parents, we really do need foster adopt parents. Some kids, really, some parents are not going to be able to parent kids. I mean, we all know that. We've been around for a while. Others can parent kids if they have very, very good support. And foster parents are in the best position to provide that support if they are willing. They cannot be arm twisted into it. They cannot be mandated into it. And worst of all, there have been actually, Annie Casey Foundation has made a suggestion in the last year that if foster parents refuse to do this, that we pull their license. I mean, what kind of crazy stuff is that? But no, this is something that can actually happen, but we have to start off with a small group of people. We have to have models, and we need to go looking for people who are already doing it on their own initiative. They just learned how to do it over a period of time. So the models are out there, and we just need to learn from them. Now, those foster parents, it works so much better when they have a whole bunch of supports around them. You know, this isn't rocket science, as the ad says there, right? I mean, foster parents have so much trouble with behaviorally troubled kids in this state, and a lot of it is because they're so much on their own. They're not experienced, they're not educated in it, they don't have the background, they don't have training, and yet we're giving them these tough kids. How do we think that's going to work there? And it cannot work unless they have a lot of supports, just like it's not going to work for the troubled birth parents unless they have a lot of supports. So there has to be some common sense, some humanity applied here. And I worked in child welfare for a long time. And in terms of public policy, it's been short on the humanity side of things. There has been a very judgmental, punitive approach for many, many years. And now that has backfired. And now there's a whole social justice movement in child welfare in this country that actually wants to destroy the whole child welfare system and start all over. And I mean, destroy every phase of it, from the laws, the policies, the investigation system, the mandated reporting, everything. They just are so fed up with what's happened here. So we got to do something different here. Okay, so I want to say a little bit on the causation thing about poverty and depression, because I don't think this gets as much attention as it deserves. So one of the things we know about poverty and depression is that low-income people have poverty rates that are about 2 to 3 times higher than people who are not poor. And that depends on the difference, the ratio depends on the standard that's being used here. Whether, example, someone has a DSM kind of a diagnosis versus a self-report thing. If you ask low-income, in past years, if you ask low-income women on TANF, on welfare, if they had had depressive symptoms in the last year and you gave them a checklist of depressive symptoms, 40 to 50% of those women said they had been depressed in the last year. If you used a standard that was based on a DSM diagnosis, that would probably be in the 15 to 20% realm. That is for low-income parents there. That would still be about twice what it is for families who are not. So one of the things we know about depression is that it's a function of powerlessness. So think about the groups in this country and in other countries as well who have higher than average rates of depression. So I've already mentioned poor people have much higher rates of depression than people who are not poor. Women have higher rates of depression than men. African Americans have higher rates of depression than white people. People who are on the bottom of a bureaucratic hierarchy have higher rates of depression than managers. So think for a second, what do all those groups have in common? It's the same factor. Their power, one group has less power than the other group on average. Not in every single case, but on average. So depression is strongly associated with powerlessness. And so that is one of the sort of the mediating factors for how poverty results in child maltreatment. And so there has been a lot of speculation over the years, and that's what it's mostly been in terms of the scholarship. A lot of speculation on, well, how does poverty exactly result in child maltreatment? I mean, whether that's physical abuse or neglect, or what actually is sort of the causal kind of sequence, not exactly the A causes B, but what would be the mediating factors there, right? And so the most common explanation for many years was that, well, poverty is very stressful, which obviously it is. I mean, so, and for years that seemed a satisfactory answer to a lot of scholars, but of course it's a superficial explanation. In fact, I would say it's a non-explanation. And, you know, the way that stress is used in normal conversation in this country, it's used to explain anything and everything, and as a result, it really doesn't explain much of anything at all from my standpoint. So if you think about what it really is to be poor, then think about first material hardship. So you have a lot of low-income people, for example, in this country who could not afford dental work. So in the last week, I had a root canal. I would hate to think that I would have to live with the pain that preceded that root canal because I couldn't afford a dentist. And yet, many low-income people in this country, that's exactly the situation they're in and have been in forever, for decades. We don't view dental care as a right. It's not a universal right. A lot of people have dental pain. That's material hardship. Living in lousy housing or no housing at all, that's material hardship. Food insecurity is material hardship. That's not stress. It's not the stress of food insecurity. It's food insecurity. It's being hungry and having no sense of where your next meal is coming from, right? Being in pain and being unable to get medical attention, that's material hardship. So that's one of the ways that poverty results in child maltreatment, through material hardship. And then, of course, through depression. So one of the things we know from studies of depression is that particularly major depressive disorder, and that's the sort of the severe form of depression. You know, most of us know what depression is. I'd be surprised if anyone on this call hasn't been depressed many times in their life. So depression is kind of like the common cold of mental health conditions. We all kind of know what it is. Okay. Major depressive disorder is not the common cold. I mean, it is to the common cold what a very severe flu is to the common cold. It is a very painful, disabling kind of a condition. Particularly, so you end up then with people who are just virtually immobilized because of major depressive disorder. So depression turns out to compromise two major functions of parenting. And one of those is the ability to make good decisions. And the second one is nurturance. Depression undermines the capacity to nurture babies, especially in toddlers and very young children. And it undermines the capacity to make good executive decisions. So part of being able to make good decisions is the ability to restrain impulses. That is the ability to think carefully about and to plan and to do things in a very deliberate way. Depression undermines that ability. And so what I used to have to tell, I do lots of training on neglect. And one of the things I used to tell caseworkers a lot of the time is that it's easy to judge the parents and the families that we're dealing with in child welfare. It's understandable that that would be so because a lot of behavior is so bad here. But the thing to do a lot of times better than judging them is to step back and ask yourself the question, how did they get into this condition? What happened to this person in their life that they got into this condition? And one of the answers to that question is they started to have a whole succession of major depressive episodes. So one of the things we know about major depression, it's as chronically relapsing as substance abuse is. So I want to say that again. Major depression and PTSD, by the way, are as chronically relapsing as substance abuse. And so having one episode increases the likelihood that you're going to have a second episode. Having a second episode means that you're going to greater likelihood of having a third episode, and so on. I mentioned before the Kathy Whittem longitudinal study of kids who were made legally dependent in Missouri in the 1960s. Those parents who were in their late 20s, early 30s at the time that Whittem went back and talked to them about their mental health status, who had been legally dependent in Kansas City in the 1960s. The average, if they had had one major depressive episode, anyone who reported that they had been severely depressed once, the average for that population was 7 episodes of major depression by the time that they were about 30. Major depression is disabling, both physically disabling and emotionally disabling. So that's why I think depression is such an important factor. So, you know what, someone asked me just a few minutes ago, well, what's the take-home lesson for advocates, or for how would we help people? Particularly for many of the women, particularly a lot of the single parents, but a lot of the mothers, that is, you're talking about a very depressed group of people, and who've developed, as Ryan said earlier, kind of a hopeless, helpless. They don't really believe that we have anything that's going to be able to help them, right? So they're very difficult to engage in services and so forth. So let me go. So Ambrosia Earhart said, there's a family connection program in Washington that pairs up seasoned foster parents. Yes, this is one of the best, most exciting child welfare innovations, in my opinion, in this state going on at the current time. And we just want to get more of this funded. And we need the legislature to step up and for once do the right thing here, which, by the way, they haven't, and for a long time. So Carolyn, I agree we need to intervene earlier. I just wonder how we as a culture can get there. Right now, it seems that reporting neglect doesn't result in any action. A lot of times it doesn't result in any action until it becomes serious. So one of the things I do, and I have done neglect training in this state for 20 years. And one of the things I tell caseworkers over and over again, if you're going to be effective in intervening with neglect families, you can't wait until neglect is chronic. Services aren't going to work well with chronically neglected families. That's not because there's anything wrong with the services. It's because we intervene too late a lot of the time. So yeah, and a lot of times the child welfare system has to see some evidence of danger. So the child welfare system here is using a safety framework that's lousy. And particularly for the neglecting families, it's really lousy and it's dangerous because it's encouraging or endorsing doing nothing until very little kids are actually in danger. That's crazy. You do exactly the opposite thing. You intervene and give services before there's danger. You try to prevent danger here. So I guess I want to say one other thing here before I open it up a little bit more for discussion here about how poverty operates in terms of how it gradually affects people's behavior and parenting over time. So some of you may have, I hope you have anyway, some of you may have seen the recent series on Netflix called Made. Have any of you seen Made? If you haven't seen that, I want to recommend this. This is actually set in Washington State. It's set up on the peninsula there in sort of the Port Orchard, Port Townsend kind of area there. And this describes, I just want to talk about it just a little bit because it really, this show really reveals something really important about poverty. This is about a young mom who grew up with, has one child. She's living with a guy who's emotionally abusive to her. He frightens her to death. She leaves him. She has a history where she grew up with a mentally ill, a bipolar mother who's an artist, you know. And she ends up leaving this guy because of one night he becomes violent and throws stuff, frightens the shit out of her. she ends up in a DV shelter. She ends up eventually in this show losing everything. She's in the DV shelter. She doesn't have anything in terms of possessions. She can't work because she loses her car partly because of her own bad decisions. She doesn't even have a car to get to work. Her family will not help her. Her mother is erratic, kind of half crazy a lot of the time. The guy that she's living with or has lived with is left as an emotionally controlling person. Her father, she doesn't want to accept help from her father because he was violent toward her mother, as that's her memory when she was a young child. She becomes a maid to very, very wealthy people, a lot of very wealthy people in that community, and they don't treat her so great. So this is a young woman who is trapped. This woman is trapped 6 ways from Sunday. She doesn't have transportation. She doesn't have housing. She doesn't have family support. She doesn't even have clothes for a kid. She doesn't have food. She doesn't have anything. And yet, you know what she does have? She has intelligence. She has a fighting spirit. She's a resilient kid. She grew up being a parentified sort of kid who parented her mom, her mentally ill mom. She thinks rationally and logically. She's brave. She's courageous in lots of ways. Her judgment is often wrong, it seems like, as you watch the thing. But she has a strong ego. She has a fighting spirit. And you can see that there's a possibility that she is going to actually overcome her condition here because she has the sort of the emotional and the intellectual assets to do that. And even then, in this show, she needs the help of very wealthy people who come to her aid and assistance. Otherwise, she loses her kid. And some of these wealthy people, she cleaned their houses, they take mercy on her and they find her a great attorney. She just goes to court and, it's all different because, she has money behind her. What does she have that our clients don't have? She has good judgment. She has some support there. She has hope for the future. She actually has college level ability. At the end of the show, she ends up going to college on scholarship. She's smart enough to leave this guy as soon as he's abusive. She has alliances with other battered women and with helpers in the community. She is able to form relationships with helpers. She doesn't give up. There's an episode where she's in the DV shelter and she's so crushed. This whole thing has just crushed her. And she's on the rug and she just said, well, I just can't get up. And this woman who's in there, she becomes a friend of hers, and she gets her off the rug and said, get off the rug, get off the floor, and start getting angry and start fighting. That's what a lot of people in child welfare system have lost that. They have been crushed and they are demoralized, and it shows up as hopeless, helpless kind of behavior where they're making every kind of bad decision someone can think of there. And by the way, this other young woman in Maid, the other asset she has is she doesn't have a drug alcohol problem. She isn't a user. But everyone in her set is a user with the exception of her father, whose help she will not accept there. So she's not doing herself in with drugs. And she does get depressed and she does get PTSD, and yet she recovers from it with the help of other people. So it's not like she's invulnerable. She's not invulnerable. She ends up with mental health problems as a result of what happens to her, as anyone else would. But she gets off the floor and she fights. And and she does it intelligently, thoughtfully, and without giving up. And a lot of times it seems that she's totally defeated. That's just not what's present in a lot of the parents and families we're dealing with here. But that's the kind of behavior we want to see. And I want to say that again. How do you know that someone we're dealing with in child welfare, one of these chronically referring families, 6 or 8 reports by the time the child is 2, substance abuse problem, DV issues, depression, and so forth. And let's say the person goes into a treatment program. How do we actually know we're making progress there? Is it really because the parent completes the program and hopefully becomes clean and sober? Or is it because she starts to cope. She starts to do things on her own initiative. She starts to reach out for help. She accepts help. She fights back. She doesn't give up. And when she screws up, she accepts responsibility. That's the kind of behavior. That's what's called self-efficacy. That's what's missing in a lot of the low-income folks that we're dealing with in child welfare. And those are the signs of recovery. So for those of you who are CASAs, and I will say this again, how do you know that the clients are really getting well? It's not because necessarily people are completing programs. They have some letter that says, I got through the program. No, it's because they're showing in behavior that they are becoming more self-efficacious, even if they occasionally have relapses. And that means they reach out, they do things on their own, they take initiative, they reach out for help, they accept help. And sometimes they have setbacks in treatment, and yet they get off the floor, they try again. Those are the signs of recovery. They leave someone who's violent with them. They don't accept emotional abuse, much less physical abuse. So, and it says she had hope, yes, and she did. And at times it seemed to be crushed there. And yet other people, she didn't do it on her own. She did it because she had great advocates in the DV shelter, because these wealthy people took mercy on her and they came to her assistance, because she had a great advocate there in terms of an attorney at a point in time. And of course, incredibly, it's partly because she loved her mother, even though her mother gives her every reason in the world just to totally reject her. She has the capacity for nurturance. She has the capacity for love based on her childhood. So she hasn't taken the kind of the psychological hits that a lot of our clients have. So a lot of our clients, they're not only poor, they have trauma histories. So all this stuff about trauma-informed care here that, you know, mostly the thinking is applied to kids, it applies to the parents. How do you think the parents got in this condition? Because a lot of times they had combinations of trauma history, poverty, and then of course violence in late adolescence or in their early 20s. Right? Tim says she learned to advocate for herself. Yes, she learned to advocate for herself. Right? So let me stop here. So for a second, so it's 15 after 7, and so we've got a time for any kind of comment or question here in relationship to either practice or policy or studies or whatever here. So what would you like?
But then how can we help and support people to get off the floor? I mean.
So again, you have to think about, so there's always a rule about helping people and engaging people. And so and I use this rule with caseworkers. And so let me offer you the rule. And the guideline is from sort of Social Work 101. You join to need. You engage people by joining to need. And that is all ages, all IQs. If a person has an 80 IQ or 160 IQ, or if they're 2 months old or they're 75 years old, it's the same rule. So initially, what you have to do then, the initial problem with lots of the families is getting them engaged to the point where they will actually do things on their own behalf. And so a lot of the families that are demoralized, that have the homeless, hopeless, helpless thing, they don't really believe that anything is going to help them. You know, they may have been in substance abuse treatment before, they bombed out of it, didn't help them. The depression treatment, they may have done the same with that. So even though a lot of times you're offering help, initially they're not accepting it. And so the initial challenge for caseworkers, and sometimes it is for, I think, for CASAs as well, is to engage people enough so that they will start doing things on their own behalf, okay? The thing that helps a lot of times, it isn't going to be possible for some of the people unless they have better emotional support. So again, if we want people, for example, in substance abuse treatment programs, they've lost their kids, right? In addition to being in the program, they need a mentor. They need an advocate. And I don't mean you or a CASA person. I mean someone in the community, whether it's a parent mentor, whether it's a therapist, whether it's a minister, whether it's someone in their extended family. So the combination of concrete supports and emotional supports. That's what it's going to take for lots of the families. And it's going to take a very persistent effort to get them engaged in services. And so for the most part, a lot of the time, the families are just so off-putting initially. They're just so resistant to any kind of help that people kind of give up on them and start judging them. And it's understandable that that would be so, because they have so many needs, and yes, they will not accept help a lot of the time. So the first, I guess, the thing I'm trying to get across here is people who work in child welfare, they need to get really good with engagement skills. And that's something that everyone can study and everyone can practice to a certain extent. So I want to give you a kind of a movie that I use in training from time to time, and I saw a few years ago. And so this is an American movie, and I'm going to try to think of the name of it here in just a minute. I've had one of these kind of memory blanks here. But in the meanwhile, just briefly, what I'm going to say before I think of the name of it, I'm going to give you kind of the idea here. This movie's about a 18-year-old kid who had been a hockey star and from a wealthy family and beautiful girlfriend, smart, going to an Ivy League school. When he's 17 years old in the spring, senior year in high school, he's driving around in a car with his girlfriend, a couple of other friends. He's driving on a country road at night, turns off the light, he accelerates the car. 30, 45 seconds later, he hits some farm equipment in the middle of the road. His girlfriend is killed. Another of his friends in the back of the car is killed. And then he ends up with traumatic brain injury, which means he can't remember what he did 10 minutes ago. And he also has a limp. And so then the movie goes forward a year. And now he's a year older. Didn't go to the Ivy League school. He's working at a bank on a night shift. He doesn't have any friends. The community has ostracized him. He's a very depressed young man. He doesn't have a girlfriend. And this criminal gang comes he's at a bar one night before he goes to work at this bank. A criminal gang comes in and decides they're going to engage him in their robbery thing, and they need to connect with him. They have about 15 to 20 minutes to do it. Well, what this movie does then, it shows what the street smart criminals do to engage this young man in 20 minutes. They don't know him. What do they do in 20 minutes? So they use the social work 101 sort of guideline that I gave you before. They join to need. And so they happen to be very good at intuiting what his needs are. And so you might think for a second, well, what would that be? I mean, he doesn't have any friends. I mean, he doesn't have a girlfriend. He's sexually deprived. He's 18. You know, he used to be an alpha male. Now he's nothing. People in the town won't even talk to him at all. So they understand right off the bat that the way to connect with this kid is by affirming his worth. They connect with him by affirming his worth. How do they know to do that? Because they're just intuitively street smart about it. And so they connect him, of course, with the young woman, not just for a one-night stand, but ongoing relationship. And they exploit the kid, right? They get him engaged in the bank robbery. That's what they do. But the point I'm making here is you can watch this movie and see in about 15 to 20 minutes, what do really skilled people do when they want to engage someone that they don't know at all? And in 15 to 20 minutes, they can establish a relationship with this young man. You know, and they didn't learn it in a social work class. They didn't learn it in a book. They didn't learn it in a lecture, in a TED talk. They learned it on the street by life experiences or in prison. So it's the ability to intuitively connect to needs. And the needs that people have are from A to Z. You would think, well, they're all poor, but it's not always the poverty-related stuff. A lot of times it is, but it frequently isn't. For this young man, he needed his worth affirmed by people who remembered that he was a great hockey player, that he was an alpha male in his high school. He was a big, important guy in that little town. That's what he needed. I had a client once in Tacoma. This caseworker told me that he had a client that felt that all she was ever doing was just surviving from day to day. Her life didn't have any meaning and purpose apart from this meeting her own survival needs. He set her up working feeding the homeless a day or two a week. And for her, that was meaning and purpose. For her, that was super valuable. But for other people, it wouldn't be important at all. There's some people we talk to in child welfare, they're very concerned about their kids. You can actually sit there and have a conversation with them about their kids, and they're really engaged because they're really concerned about their kids. And that's just such a great sign. That's just such a sign of strength. So that's what I'm trying to say. There's got to be a way to connect with people. And the way you know that you connected to someone is they pay attention to you. How do you know when you're teaching? And, I've done training for a lot of years, and I've had many, all kind of experiences, both positive and negative. So when I'm in a classroom, I can tell very quickly if I'm losing people. I used to get up and give people a lot of data on stuff. I don't do that much anymore because I lost whole groups in 15 minutes. So over a little bit of time, you find other things that work better. And for example, telling people stories like I'm telling you now, that works better than giving people data usually, right? People are interested in stories. So how do you know that you're actually engaged and connecting with people? You have their attention. If you don't have their attention, their main motivation is how do they get you out of their house as quickly as possible? How do they make you feel so uncomfortable that you want to leave there? And they're good at it. Pretty nonverbal, not too interested in conversations, not interested in any help you're going to offer them, right? So the initial challenge to everyone who's in the helping professions, child welfare, mental health, substance abuse, VV, it's always the initial connection, the initial engagement part of things. You got to get people up and moving and doing stuff on their own behalf. And initially, that is going to be baby steps. It's not going to be big, huge, I go into a program. You want someone to actually get up and take out the goddamn garbage. Clean up the dog feces. Start doing little things and give them help in doing little things and give them a lot of recognition and praise for doing those things. So anytime you want people to do more of something and less of something else, you praise whatever the behavior is that you want to see, and you praise it a lot. And then there will be a point in time when you don't have to praise it. And that's when you know people are becoming more self-efficacious. You don't need to tell them they're doing great all the time because they're doing great. They've learned it on their own. So those are sort of the helping rules there, right? And so if you're not connecting with people initially, then you need to kind of figure out, well, what is it going to take for me to connect? And by the way, there's always an answer to this, always. The question is just, do we recognize it? Do we have the skills? And with low income people, initially, if you don't have any other hypothesis, you start off with concrete needs because they have so many of them. So in the absence of any other hypothesis, you start off there, right? And again, how do you know that you're making impact? It's the quality of attention that they're giving you. They perk up. They listen to what you have to say. If they're not doing that, you're not connecting with them. They aren't going to do anything different as a result of your encouragement or visit there, right? So let me see, 725. So let me see. Tim says motivational interviewing. I'm very, very supportive. I'm very positive about the potential of motivational interviewing to particularly help people in the substance abuse area there. And again, that is something that you really do have to be trained on that. It's not enough just to read books or to go to training programs. You really do need some training and coaching on how to do the motivational interviewing, right? But one of the key ideas in motivational interviewing to keep in mind here is that you want people to tell you what's positive about using drugs. Why is meth the greatest thing that I ever did? What's great about heroin? And people who are good at motivational interviewing can listen non-judgmentally, and they can elicit that kind of input from people who are drug users. What's so great about taking whatever the pain relievers are? Because if it wasn't great for them, they wouldn't have done it. And so the way you overcome resistance is you get people to talk about why they're doing things without judging them. And then you just ask them this one single question. Is there a downside? Have you found that? I mean, you have all these wonderful things that you're telling me happened as a result of using these, this opiate, but is there a downside to using the opiate? And when you've had a breakthrough with someone, they will tell you the downside. You don't want to sit there and tell them the downside. That's being inept. That's an inept therapist who tells them the downside. You want them to tell you the downside. That's when you know you've made some kind of connection there, right? And so sometimes the best idea is to bite our tongue, to not give any more advice than we've already given. You're just making things worse. Not to be aggressive in terms of the confronting the behavior, because that's the lesson of motivational interviewing. That's just making it worse, right? Yeah, Ryan Murray, The Lookout. Yeah, wow. Well, this is just, yes, Ryan identified the movie, which is from, and you can find that movie. That movie is still around. I recommend it. But if you want to just figure out how to do better at engagement, all you got to do, if you don't want to see the whole movie, just watch 15 to 20 minutes of it when they're in the bar. So, okay. Ambrosia says, Parents for Parents programs are in most countries in the state, mentoring resources to help parents, led by parents that have been successful in reunification. Yes. And again, these are parent mentoring type of programs. And there are a small number of those programs in this state already. And again, this is something the legislature could do, and it wouldn't cost a tremendous amount to do it either. So a lot of the stuff that's happened in child welfare reform in this state, the thing that's blocked that is not money, contrary to what you hear a lot of the time. A lot of the things that would be, some of the things really do cost money. Housing costs money. But a lot of the things, for example, the mentoring programs, they don't cost a lot of money. Foster parents supporting birth parents, that costs some money, but it's not a lot of money. It's not funding that stopped most of the good ideas. It's bad ideas that have stopped the good ideas. And it's the refusal of policymakers to listen and to reconsider when things they're doing are not working. They just do more of the same old, same old. So, you know, it's time to do something different here. And that means from A to Z. That means from the prevention end, that means all the way through the foster care system to the very back end where we're talking about reunification, termination of parental rights, adoption, and so forth, right? From A to Z, we need to start doing different kind of things, right? So, and some of them cost a lot of money. A lot of them don't cost any money at all, or very, very little. So let me stop with that. I'm going to give you, it's almost 7:30. I'm going to give you an email address. My email address is deewilson13@aol.com. Anyone who would like a PowerPoint that incorporates some of this material that I've talked about here in kind of a disorganized way. If you like PowerPoints and are interested in it, you can send me an email request. Be glad to send it to you. I have lots of other information and summaries on this particular subject. So I'd be glad to share whatever I've got here, and I've got a lot of stuff depending on what the nature of your interest is. And so, yeah, you can send me a request on an email, and I would be glad to provide. So my email is deewilson, WILSON 13@AOL.com. And so, of course, those of you who are computer savvy, you recognize that if anyone who has an AOL email address, that means they're an old fart who doesn't know anything about computers, right? So that's definitely me. There it is. So, but still, it still works. I still get the email and I still do respond to them. Right. So I think with that, let me see if anyone has any last comment or question here.
Just thanks for what you do, Dee.
Thank you.
Thank you so much.
Thank you. Appreciate it. Yeah, good luck to you guys.